Hi, I'm Rachel Walfair of InspiredHygiene.com. I want to share with you today an article that I came across recently that I think you'll find very interesting. So even 25 years ago when I was in hygiene school, we knew about the connection between diabetes and periodontal disease. It was very clear. It was something that we learned about, way back then. But there are some new developments in this connection, and I want to share this with you today. So this article was published in the Journal of Periodontology in 2013. And it's diabetes and periodontal disease. It's a consensus paper. So basically, the European Federation of Periodontology and the American Academy of Periodontology got together and said, okay, let's look at all the research. What do we know about the connection between periodontal disease and diabetes? So I want to share 3 things that I got out of this paper that I think you're going to find fascinating. And you can access this paper with the link right below this video. So just click on that and you can get the whole thing. Okay, First thing, it's really important to know that patients with periodontal disease have an increased risk for type 2 diabetes. So your patients that you see with active gum disease, you want to know and look for other signs of diabetes, right? Obesity, poor wound healing, areas that even though you treat and do the best job and your patients are working really hard, you're still seeing bleeding and they're just not getting the healing that you're expecting, okay? So increased risk for developing type 2 diabetes in patients with periodontal disease, okay? The other thing that's very interesting is patients with moderate to severe periodontal disease have a higher risk of complications with diabetes that cause death, okay? And these are things like heart attack, kidney failure, calcification of plaque in the arteries, thickening of the wall of the carotid arteries, all these things that lead to heart attack, stroke, and cardiovascular problems, okay? Now, the third is very interesting, and what they looked at is the HbA1c level. So if you've heard of these videos before, you've probably heard us talk about the HbA1c. This is a question you want to ask all of your diabetic patients. What was your last HbA1c? And this number is a snapshot. It's a blood test that's taken about every 3 months by diabetics, and it shows how well their diabetes is controlled. Okay, and you can know based on their number how well they're controlled. So what they found with simple non-surgical periodontal therapy is that it reduces the HbA1c number. Now, this study revealed that it reduces it by about 0.4%, which doesn't seem like very much in the grand scheme of things, right? But what's fascinating is they say that reduction in HbA1c level is equivalent to adding a second medication to the patient's pharmacological regime. Okay, so review this again. Non-surgical periotherapy causes a reduction in the HbA1c equivalent to adding a second medication to their regimen. And they mention that if that reduction is maintained, it reduces their risk of dying from complications from diabetes and other conditions. So this fits right in with you stepping into your role as healthcare provider and really taking your care to the next level for your patients. Thank you. We'd love to hear your comments and questions below. And until next time, have a great day.